Right. So I'm going to ask you, okay, the Biden administration's listening right now. What do they do? What, in your opinion? I have my thoughts about public health, declaring a public health emergency and doing research and inoculation programs, PSAs on mind control and how to discern a legitimate source of information and how to trust science and what the scientific method actually is and how to be a good citizen and I that's my thoughts, but please share some of your thoughts. The Bidens are listening. Fingers crossed. Somebody in their administration's listening.
Well, of course, he could have done a lot when he came into the presidency to recalibrate and bring us back to reasonableness and just
Well, I think he's
norms.
done a lot,
Yes, he
actually.
has. He has, and in fact, he has done certain things far beyond any presidency. But as far as mental health is concerned, I have to say he has skirted the topic, and he has
Mm.
not brought the kind of attention that the lessons of the Trump presidency should have brought, such as to strengthen the 25th Amendment, for example. When early on there was a lot of discussion of the 25th Amendment. And in fact, I was invited and my colleagues were invited to speak with more than 50 Congress members who said that if we were able to educate the public on the medical aspects, then they would be able to act politically. And even the
Hmm.
drafter of the 25th Amendment himself, John Ferrick, said that he meant the amendment to be driven by medical data, not by politics. And
Explain to my listeners what it is, because I'm not sure everybody knows what the 25th Amendment says.
yes, the 25th Amendment was an amendment that was added in the 1960s to to clarify succession of presidency. But it has a clause in
Hmm.
there that if a president, for whatever reasons, physical or mental, it becomes unable to discharge his duties of office, his or her duties of office, then the basically the cabinet and the vice president would step in and even involuntarily remove him for there to be executive capacity, mental capacity in the executive office. But what is not spoken about is that this should be data driven and driven by medical data when pertinent and mental health data when pertinent, that it should be based in reality. But instead, it was turned into a purely political exercise that the vice president would drive, whereas in fact, John Ferrick clarified in many of his workshops and in the conferences that we spoken
Hmm.
together that the vice president was meant to come in last. So, in order to improve the viability of the 25th Amendment, Jamie Raskin and other representatives had put in a bill that would kind of build in medical professionals into this body that would
And
decide.
bipartisan medical professionals, so there's
Yes,
no accusation that there's
that's right.
partisanship, that it's really based on clinical data and specific things.
Yes,
But I guess for me, as the non-politically educated, really, or savvy person, it seems to me if the president picks the cabinet and the vice president, isn't there a conflict of interest? Like, shouldn't there be some mechanism where Congress or Senate should vote and call upon
exactly.
a medical
And
evaluation?
that is the other body that the bill would have supported. Exactly.
Ah,
So there,
yeah, that makes sense.
absolutely, it was a viable avenue and actually a just avenue that was turned inoperable partly because mental health professionals were silenced. And I and my colleagues have also told the then Speaker Nancy Pelosi that She needed to have mental health expertise or even to consult with us in private to be able to be
Mm-hmm.
successful in her impeachments. She
Mm-hmm.
did not do that, and as a result, both impeachments did not go any further than the House of Representatives, and also prosecution. We had advised that that this should be carried out in a way that takes into account mental health aspects, so that Donald Trump cannot turn into a purely political exercise and make it ineffective. And also the COVID pandemic management. As I said, we
Right.
had advised that because that presidency was overwhelmingly more of a mental health emergency than anything else, that mental health expertise would be helpful. But of course, it's hard to do when the public is not informed.